Hypertension is a common medical condition found in over 22% of Canadian adults. 7% of all doctor visits are brought upon by hypertensive concerns, placing it only behind visits for the common cold and sinus infections. With how frequent hypertension is in our society, it's important to understand the condition and its management in the event that you or a loved one are diagnosed. This short video provides a brief overview of this common condition, covering why it occurs and how it can be appropriately managed, particularly in the aging heart. Blood pressure is a measurement of how forcefully your blood pushes against the walls of your blood vessels. We divide this measurement into systolic and diastolic blood pressure. Systolic blood pressure is the maximum pressure experienced in your arteries during the heart's contraction phase. Diastolic blood pressure is the minimum pressure reached in your arteries while the heart relaxes between contractions. Higher numbers, which are measured in millimeters of mercury, indicate higher force of the blood against the vessel wall. Optimal blood pressure in the general population is under 120 and 80 millimeters of mercury for systolic and diastolic pressure respectively. Stage 1 hypertension diagnosis occurs when systolic blood pressure falls between 140 and 160, or when diastolic levels fall between 90 and 100. Stage 2 hypertension is more severe, with diagnosis occurring with a systolic pressure above 160 or a diastolic pressure of 100 or higher. Excessive increases in systolic pressure are more common with age. Hypertension can be either primary or secondary in nature. In primary hypertension, the cause is unidentifiable and the standing alone. In secondary hypertension, the increased blood pressure is caused by a specific condition such as kidney disease, thyroid dysfunction, or obstructive sleep apnea. Primary hypertension is the most common, with 90% of patients experiencing this type. We'll take a break from all these numbers to explain why blood pressure changes and why these changes can cause problems. Blood pressure depends on the amount of blood output from the heart and the degree to which the blood vessels resist blood flow. When the body ages, blood vessels change and tend to lose their elasticity. They become stiffer, making it harder for blood to be pushed through them. Reduced flow through blood vessels means a reduced blood supply for the body, so the heart must compensate for this increase in resistance by working harder to pump blood. When the heart is forced to work harder, the body is put at an increased risk of cardiovascular problems such as heart attack, heart failure, and even stroke. Blood vessels are also susceptible to damage due to the increased wear and tear caused by blood pressing more forcefully against vessel walls. It is these complications that make unmanaged hypertension dangerous. The unavoidable process of aging, there are a few other factors that also tend to increase blood pressure. Obesity, high blood cholesterol, excessive salt intake, smoking, excessive alcohol consumption, regular consumption of certain drugs, and leading a sedentary lifestyle all further promote hypertension. The good news is that we can change these factors. Lifestyle changes including losing weight, eating fewer fatty foods, restricting salt intake to 6 grams or 1 teaspoon per day, quitting smoking, moderating alcohol intake, reducing certain drug dosages, and taking part in moderate exercise for 30 minutes a day, 5 days a week, are all shown to reduce blood pressure. The goal of these lifestyle changes is to lower blood pressure as much as can be safely tolerated by the patient, with a systolic blood pressure of 140 millimeters mercury being a common target in individuals over age 65. If lifestyle changes aren't enough to achieve this reduction, there are several classes of antihypertensive drugs that can be added to the patient's management regime. These drugs act in various ways to reduce blood vessel wall stiffness and therefore lower blood pressure. Examples of these drugs include beta blockers, angiotensin converting enzyme, or ACE inhibitors, and angiotensin receptor blockers. Different drug classes are successful in different people, so it's best to discuss drug options thoroughly with your doctor. It is also common to take multiple blood pressure drugs at a time to achieve an ideal blood pressure. In the case of secondary hypertension, medical treatment of the underlying cause in the patient will also treat their high blood pressure. If you or a loved one are worried about hypertension, I hope this brief introduction to the condition has put your mind and your heart at ease. For a more thorough understanding of hypertension treatment strategies, please seek further medical guidance.